Petrissage or kneading. Techniques variations one-handed. The entire hand or the pads of the fingers and thumb can be used to lift the tissue. This variation is well suited for smaller muscular areas such as the arms, top of the trapezius, or the arms and legs of a child. Both hands are lifting, compressing, and releasing the tissue simultaneously. It is often used to address larger muscular areas such as the back. Two-handed praying hands. Fingers are interlaced in a praying hand position. It helps maintain proper position. As though you're rolling a pencil using your fingers to scoop up the skin as you move across the area.